Awesome. Okay, guys, thank you so much for joining us. It's Dr. J here, and today I have a special guest with me, Dr. Jessica Drummond, a mentor, a role model. I mean, you insert word here. She's amazing and a wealth of knowledge. And I wanted to bring her on to talk about a topic that affects a lot of women, but a lot of women don't know enough about, and that is endometriosis. So Jessica, welcome.
Thanks so much for having me. I'm so honored to be here.
Thank you, thank you, thank you. So when we talk about endometriosis, I think first of all, what the heck is it? Because a lot of people have, they've heard maybe, I've got endo because I hurt, I have pain. And then some of them are like, well, I don't know what I've got. Or maybe they've had a diagnosis because just somebody has said, well, that's what you could have, or, so tell us a little bit about what it is and kind of what's typical in its presentation.
Yeah, that's a really good point. I mean, endometriosis is an underlying disease process that I like to think of as a non-cancerous cancer. So it's actual tissue lesions, sort of like in cancer, we have tumors, and endo, we have these like tissue growths. And the tissue is similar, but not exactly the same as the tissue that's inside the lining of the uterus, which is called the endometrium, which is why it was originally called endometriosis. There were some old theories about it being like because you were menstruating in the wrong direction or something like that, but that's all been disproven. So what we do know is that endometriosis has some genetic underpinnings. So a lot of times you'll hear like, oh, all the women in my family have bad periods, or, my mom had endometriosis, or my aunts were really fatigued, or they had a lot of autoimmune diseases. There's a lot of kind of overlap of that, which is a little challenging actually, because then in the family, even the really painful periods and the pelvic pain in general is kind of like normalized. It's sort of like, oh, that's just how periods are. Like, get used to it. Welcome to womanhood, all that kind of thing. But the truth is that the common presenting symptoms are pelvic pain, period pain, not always pain with periods, sometimes pain between periods or kind of randomly, especially when we're talking about teenagers. So it presents during kind of pre-puberty and puberty, but the lesions even show up in fetal analyses. So like the lesions can have been there from birth, but the symptoms generally begin around age 8 to 12, prior to puberty, when digestive symptoms will start. Then you'll have pelvic pain or period pain or both, randomly or during the period, fatigue, a lot of anxiety, a lot of exhaustion, insomnia, infertility. So some people have no pain at all with their endometriosis, but they don't find out that they have it until they're struggling with infertility. And ultimately, endometriosis is a surgical diagnosis. So you don't know if you have endometriosis for sure unless you've had a skilled surgeon who does basically nothing but endometriosis surgeries or similar kinds of surgeries all day, do a laparoscopic assessment and surgery and make the diagnosis. But there are some ways to guess. There is some imaging that if it's seen on imaging, then you do have it. You can check for inflammatory markers. There's some things that increase the suspicion of endometriosis, but ultimately it's a surgical diagnosis. It's based on all these various symptoms, and causally it has a genetic underpinning. It's an inflammatory condition. And probably, in my opinion, although there's debate among experts on this, there is an autoimmune component. So, and some of the lesions have upregulated estrogen receptors and or progesterone receptors. So sometimes it's hormonally driven, sort of how sometimes like certain breast cancers are hormonally driven, which is why it can often relate to puberty. Sometimes the symptoms can improve in menopause, and sometimes, estrogen suppressing medications or hormonal birth control can be helpful because some part of it is hormonally driven, but that varies and it's not as cut and dry as we once thought.
Mm-hmm. And you brought up a lot of good points, because a lot of people will often have symptoms, whatever these symptoms may be. They complain their entire teenage years and they say, oh, my periods have been awful. I've had all this pain. I've had to miss all these days from school. They go through college, and it's not till they get older. I mean, because when you're young, missing a couple days from school every month is not going to be as detrimental to your life as your working adult with limited PTO and a boss who may not be very forgiving, and you have to miss days from work. So then,
right.
The context surrounding life changes, but these symptoms persist. And it's not until these things start to affect more of their life that a lot of women start to try to seek out more about what's going on. So women can go maybe 10 years, sometimes even more, through several different physicians before they get a diagnosis. So when we look at teenagers especially, what are we looking for when they're complaining of these painful periods?
Yeah, so it might be irregular, it might be cyclical during the periods, but it's definitely pelvic related pain. They, it can be described as something like killer cramps. Usually there's a digestive component as well. Bloating is really common, abdominal pain, IBS diagnosis, SIBO diagnosis, which is small intestine bacterial overgrowth, constipation, diarrhea, or alternating. Food sensitivities is very common. And again, that missing school, while it's not as immediately, you can kind of cover for it a little better than if you're working, it is the number one reason that teenage girls miss school is for the pelvic pain related to endometriosis. So to me, that's really problematic. Having a teenager, there's a lot they're trying to do now, and, be there for the SATs, show up for the state championship, track meet, be there for their exams or a presentation. And it's difficult because in teenagers, the pain can be even more unpredictable than it is in adults, because since their cycles aren't even fully regular yet, the pain can show up at any time. So it's very hard to control. And you have this underlying kind of immune challenges with excessive inflammation, likely autoimmune related things. So could be joint pain, could be other autoimmune diseases like thyroid issues, thyroid Hashimoto's. And so when the immune system is so uncoordinated, like when the immune system is overactivated, it's usually not well coordinated. Mm-hmm. So even though you have all this inflammation, you can still struggle with a lot of like colds and flus and sinus infections and, stomach bugs and stuff like that, because the immune system, when it's always kind of turned on, it's not really focused mm-hmm. in any way. So for teenagers, that's really the thing. And then the key is, because unfortunately, most pediatricians or school nurses are not very well educated in screening for this. And because it can be really normalized in a family where other women had endometriosis, it's hard to pick out until, unless they have a really educated school nurse or something like that. There is a great nonprofit called 𝘊𝘠𝘏. They created, there's a documentary that they created, and they have a school nurse education program about endometriosis that our company supports. And so I think things like that are starting to spread. It's a very big positive that like more teenage girls are tracking their cycles and recognizing that cramps shouldn't be horrendously painful. One of my friends, Jolene, she's a naturopath who does some like TikTok videos on healthy periods. I'm not quite that cool. I think my kids might kill me if I go on TikTok.
She's pretty cool if she's on TikTok.
Yeah. So there's more education out there, but it's still very much like, there's a lot of negative association, like, oh gosh, Jane is complaining again about her stomach aches or whatever. People are very, it's hard for people to really, especially in a teenager that is kind of a go-getter, maybe an athlete. it's like, oh, you know, they just want to get out of practice again, or they just didn't want to take that test. And there's a lot of overlay with digestive issues and anxiety and stress. And so, you know, that's kind of the impression that it can leave. But so usually these girls just kind of learn to power through, but it's a very painful condition.
Mm-hmm. And then we get past the teenage years, you know, where they've just been, like you said, powering through, and they're like, well, it is what it is. I just know that every month I'm going to feel like, you know, death warmed over. And so it is what it is. But they get into adulthood. Do the pains typically, and I've had some people who've told me as clients, you know, they felt as though their pain has worsened. I've had some people who've said that they felt as though their pain is not as severe. And I guess it can vary from person to person. But what then, you know, as they get older, what things can we do to start to address the pain, especially in the women who might still not have been diagnosed?
Yeah. So I think, you know, there's several pieces of the puzzle to get real root cause healing for endometriosis. Sometimes the pain worsens because the disease itself can actually progress. It can be made worse. It can be more inflamed. There can be new lesions. The lesions can spread and proliferate. So again, like cancer, you know, this is a disease of endometrial like tissue lesions, but it can be like on the lung. You know, we've had cases of lung collapse, or it's inside the nose or inside the knee, or, you know, on the bowel. So it's not actually like a uterine disease. It's actually outside of the reproductive organs. Now, sometimes it's on the outside of the reproductive organs, like on the lesions can be on the ovaries, can be on the fallopian tubes, can be outside the uterus. But you know, so the natural progression as someone lives their lives, sometimes the pain is better because as the cycles regulate or they start to have a less inflammatory lifestyle, the pain can abate. So there are kind of, I think, 3 things to do to optimize the functioning of someone with endometriosis from the root cause. There's not really an official cure, but there are 3 things that we can do very effectively. The first is physical therapy. So pelvic physical therapy is really necessary for anyone who has abdominal discomfort, pelvic pain, bad periods, digestive issues, even insomnia and anxiety, because the better that the gut and the pelvis and the musculoskeletal system around that functions, then you have better gut microbiome, you can exercise more, your periods are healthier, like all these different things. The second thing is functional nutrition, which is the approach in my book, Outsmart Endometriosis, because that takes a system-by-system approach to lowering inflammation, improving brain function, because ultimately the brain is sort of the decider about whether or not you have pain. You can have severe tissue damage. You can like literally be in a traumatic car accident and have no pain. You can have a paper cut and really bad pain. You can sprain your ankle. I mean, I've had some pretty bad ankle sprains and that hurts like heck, but it's not nearly as bad as like breaking your hip. Mm-hmm. And yet you can have really bad pain with that. So endo is interesting in that way because people can have really severe disease. It's sort of like people who have bone spurs all over their spine mm-hmm. and not have a lot of pain, and vice versa. So, you know, they can have less extensive disease and really extensive pain. So I think of endo as, from a functional approach, as like cancer or Alzheimer's. In every case, you've got these lesions, the tangles and plaques, the tumors, the growths, but you don't always have the symptoms. You don't always have dementia. You don't always have cancer everyone has cancer cells. Not everyone gets cancer.
Right.
So with endometriosis, if we can lower inflammation, optimize the functioning of the digestive system, improve health of the brain by getting good neurotransmitter levels and good oxygenation, we're not walking around anemic from all this crazy bleeding, blood sugar stability, and we system by system, digestive, immune, neurologic, endocrine, make these systems function as optimally as we can, even if the structural lesions are still there for endo, a lot of times the symptoms are massively improved. Now, for some people, the symptoms are even completely eliminated, but it's still important to have a consult, at least, with a surgeon who's an expert in endometriosis excision surgery, because that can be fertility preserving. So if that's something that's important to you, then having, even if you're symptom free using nutrition and functional medicine, it's worth considering the extent of your disease and whether or not excision surgery is appropriate for you with a surgeon who does that, because it can impact your long-term fertility. Some people are adamantly against any medications or surgeries. We do everything we can, and sometimes that's enough to have their life as healthy as they are wanting it to be. But in most cases, you can get even more benefit by layering on a skilled excision surgery, because, getting those lesions off your bowel helps,
Yeah. I
Yeah.
bet. And when we talk about, so you talk about nutrition, and I know the Mediterranean diet has been touted as one of the best, as far as nutrition goes, and a balanced nutrition type of nutrition goes. It's been touted as one of the best. What recommendations would you make to those, as they start to reevaluate their life, as they start to say, you know what, this is a problem. I'm sick and tired of being sick and tired. I need to make some changes. Where should they start? Because most often people hear, you need to eat healthier, you need to do this. And the first thing they go, well, eating healthy is expensive. Or, I don't have a Sprouts, Whole Foods, Trader Joe's in my town. So what can I do? And they kind of start like getting overwhelmed because they feel like they've got to make these drastic changes. So what are some more immediate changes that they can make to start to optimize their nutrition?
First thing to do is slow down how you eat and thoroughly chew your food. The data shows chewing each bite of food 40 times is optimal, which is a heck of a lot. But if you can just double what you're doing now, let's say it's 3, make it 6,
Mm-hmm.
if it's 10, make it 15, just slowly creep it up. That will help. Because even if we get the diet optimized, you're eating lots of vegetables, healthy proteins 3 or 4 times a day, good fats, and not a lot of sugar, processed foods, processed grains, all of that. If we're kind of starting from fast food, then in that case, then we first work on function. Do you have good digestive enzymes? Do you have good stomach acid? Which is hard for people who've had chronic illness for a long time, because their mitochondria, that's like the little energy powerhouses of each cell, are sort of depressed.
Mm-hmm.
And so it's hard to have enough chemical energy to make good digestive juices. We also need to work on gut motility, which can be helped by visceral abdominal physical therapy. It can be helped by just taking a walk every day. It can be helped by breathing exercises. So how you eat and the function of your digestive system is equally as important as the foods you're eating.
Mm-hmm.
Then in my book, we definitely outline kind of a whole process. Like if you're ready to dive in and figure out what the right diet is for you, there's a process for that, because it's different for everyone a little bit. But where you can start, if you're kind of like already a little resistant, like I don't know how to go to Whole Foods and I don't know how to cook anything. When I was teaching at a giant physical therapy meeting last weekend, I admitted to them that, I'm 45 years old now. When I was in graduate school for PT, I was like 25-ish. And we used to have like potlucks, because my physical therapy class was pretty small. We had like 35 people. And my specialty was slice and bake cookies. So I did not know how to cook at all. The first meal my husband claims I made for him was burnt hot dogs. So the good news is we now have YouTube and like a million cooking shows. You don't have to cook things that are complicated, but if you can learn to make a vegetable soup or some sauteed vegetables, or throw mushrooms and some zucchini and things like that into your pasta sauce, like keep it simple. But the first thing I would start with is two things: adding vegetables that are mostly cooked for now, because if your digestion's messed up, we don't want to like double the salads, and we also have to be careful of oxalates in some cases, which are in, like, you don't want to be juicing like huge bunches of spinach that can kind of cause some bladder pain. But cooked vegetable soups, mushrooms are great. I can't sing their praises enough. Yeah. Cruciferous vegetables, but cooked and thoroughly chewed. Protein about 3 times a day. So start the day with a protein heavy breakfast, whether that's a protein shake or a vegetable omelet or, leftover dinner stuff. That's fine. Sausage hash, things like that. Start savory, start changing your taste buds such that you enjoy savory foods and are not as addicted to the sugary foods. Because in America in general, we tend to eat a lot of sugar for breakfast. So eliminating as much as possible sugar and processed grains, things like breads and pastas. It's fine to have whole grains, brown rice and quinoa and things like that. And hydration too, because a lot of times with endo, there's bladder pain and urgency. So people are really restricting. That can actually worsen both the endo pain and the bladder pain. So add vegetables, add water, add healthy fats, avocado, olive oil, olives, coconut oil, things like that. And have about 3 to 4 servings of protein a day, whether that's in protein powders or fish, or, as clean as you can get meats, and chicken and things like that, eggs of good quality. So, but think about the adding and getting comfortable with those things, learning to cook, learning to use gentle herbs and spices like rosemary and cinnamon and ginger, turmeric, or curries, stuff like that, because you can actually in a culinary way start building up those antioxidants, which will help with energy. It'll help the mitochondria. It'll help your digestive function. And just, start learning how to cook in a normal home cooked way, not like Michelin 5 stars, but shift away from the slice and bake cookies.
Yeah, that's a pretty good point. That's a pretty good point. And it's so easy. One of my favorite go-to meals for my kids is just a stir fry. I'll get sausage and I'll just slice the sausage up and I'll throw like snap peas and, I'll dice carrots or I'll shred them, and I might throw some cabbage and some mushrooms, because mushrooms just make everything taste good. And broccoli, a little bit of broth, and then just throw the sausage in there, cover it over, and voila.
Yeah. And
we've got a whole meal.
Right. And if you kind of miss that starchy feeling, you can use like roasted sweet potatoes or spaghetti squash or, quinoa or something like that. Yeah. So it's very true. Like the simplest things like that are the most nutrient packed, and you're cooking it all together. So you preserve more of the vitamins and minerals. And so the book has recipes as well, but learning how to make simple stir fries, simple soups can really go a long way, because then you can make something out of anything. It's like our grandparents used to do,
Awesome. Now, what about supplements? Are there supplements that you would recommend if people aren't realistically getting all these things? If their digestive system isn't optimized, you mentioned before, maybe their stomach acids are still not up to par. They've got digestive issues. They're bloating. They might be having some bowel bladder things going on. Do we want to add some supplements in there to kind of help them along? Maybe some probiotics. Maybe they're not getting enough of the, clean meats. Do we want to add in like maybe a protein shake, vegan or otherwise, just to kind of boost them up? What are your thoughts on that?
Yes. So I don't like to add a lot of supplements until we kind of set the foundation, but 2 that I do use that I kind of think of as crutches for the digestive system are betaine HCl, which is essentially a stomach acid supplement. We have to be careful with that, because if you're on like acid reducing medication or, you have reflux, we've got to kind of ease into it. Can't do that at the same time. The other time it's contraindicated is if you have ulcers or ulcerative colitis or some other inflammatory bowel disease. But getting the stomach acid more robust, digestive enzymes in almost every case is really helpful. Then the antioxidants, so turmeric, resveratrol, 𝘋𝘪𝘴𝘦 actually has some really good data on endometriosis, and not only endometriosis improving the lesions, but lowering CA-125, which is a marker of risk for ovarian cancer. Because if you have endometriosis, your risk for ovarian cancer goes up to like 1.5 to 2 times as common. So it's still relatively rare. It's a relatively rare cancer, but what's challenging is ovarian cancer is really serious. It's usually not caught very early, and it's even harder to catch if you've had endo because you already have like digestive issues and the vague pelvic pain and kind of the vague symptoms of ovarian cancer. So some of these antioxidant supplements can lower that risk, which is very encouraging. I don't usually do just blanket probiotics until we have a stool test. So in my practice, we do some testing, some more functional lab testing that shows more about the bacteria in the stool and in the large intestine, and helps us to see which nutrients you're absorbing. But others that are really common are magnesium, zinc, omega-3 fatty acids, so fish oils. Sometimes it's hard to eat enough fish, plus pretty much all of our waters are contaminated, unfortunately. Most of the fish has some contamination. It doesn't mean it's terrible to eat it, but you can't eat it every day, unfortunately. There are no more clean waters left. So purified fish oils can take some of the place of that. And I do like vegan protein powders. I like some pea powders, pea rice powders, that will help, get those amino acids in, because a lot of my endo patients are really low in amino acids. So they're struggling with insomnia and anxiety, because those are the precursors to things like serotonin and GABA, these really calming brain neurotransmitters. So, we can supplement with those kind of directly, but ultimately we want to be absorbing protein, and protein shakes is a good way to do that, especially if someone's pretty active.
Yeah, I find a lot of the people that I've treated with endo, it's almost like that postpartum brain fog. And some of them aren't even postpartum, but they have this brain fog, like they're just kind of going through the motions, or so they describe it, in their day. And you're like, there's just this persistent fatigue, for a lot of them.
Yeah.
So for a lot of, I coach volleyball, and so I love my teenagers, and that's usually when it's funny because I told my kids, I'm like, all right, guys, we got to start tracking periods.
Yes.
But, a lot of kids will, complain about the period pain and stuff like that. And the first thing that most primary care doctors will do is they automatically put the kid on a pill. There's no testing. There's nothing else that has been done. It's just, they have pain, let's put them on the pill. Now, as a pelvic therapist, that can have some issues, because now we can kind of end up going into some hormonally mediated issues later on down the line, and these people may end up having some pelvic pain because of different changes there. But what are your thoughts on that, and what do you think, if we had to speak to a lot of those primary care physicians that are doing those things, like what would you tell them that they need to be mindful of?
Yeah, I think putting a teenager on hormonal birth control without figuring out why she's having pelvic pain is a horrible thing to do. Now, there is an appropriate place for hormonal birth control pills in some cases. And even for endometriosis, let's say someone has a diagnosis of endometriosis, they do this in Canada a lot, which is reasonable, but they maybe have to wait for excision surgery, or in the US, maybe they have to find a surgeon or save money to have the surgery, because most people don't have really easy access to good skilled excision surgery. It's usually an out-of-network or out-of-pocket expense. It can cost tens of thousands of dollars. You might have to fly somewhere to where you can get a good surgeon. You may have to find, you may have to go to a surgeon that takes your insurance but lives 4 states away. So there can be a process for kind of getting the surgery. You can be doing all of the nutrition and pelvic physical therapy, but you're taking a hormonal birth control can kind of quiet your symptoms for a period of time while you're doing that. And that can be super valuable because then you can keep living your life. Mm-hmm. And obviously hormonal birth control is useful for birth control, which sometimes is a good thing too. Yeah. But when we just use it as like a Band-Aid over a bullet hole kind of thing, you can risk a girl's fertility because you don't know what's going on. The disease is not being healed. It's just a mask. And so you've never given her the opportunity to have early effective excision surgery when it's easier. It's actually easier and more effective to have the surgery younger because the disease is not progressed so much. You've also robbed her of the ability to kind of understand her own cycles and learn how to take care of her hormonal health with her nutrition and figuring out how much exercise is too much for her or too little, getting good sleep, managing her stress. If we teach girls how to like really take care of themselves, their body health, their mental health, starting when they're, 13, 14, 15, 16, as they take autonomy and go off to college of their bodies and their brains, we would lower depression rates and anxiety rates and suicide rates. Oh, and the other thing is teenagers on hormonal birth control who don't get good sleep are more at risk for suicide by being on the birth control pill. That increases their risk of suicidal thoughts. And that's huge because this is already a population that, they're staying up too late. They're, so sleep is so important and learning to track their cycles. And if they're having pain, sometimes just doing some simple things like balancing their blood sugar or supporting the liver by eating more vegetables. I mean, there's a lot of teenage athletes who live on Slurpees and pizza and stuff like that because they can get away with it. And dude, I wish I had my 17-year-old. Yeah. I eat super healthy right now. I take great care of myself, but still, if I could spend a couple days in like a 17-year-old body, I would.
Yeah. Those were the good old days.
So, in a way you can get away with it then, but we still don't want to be masking things. We want to be teaching our teenagers how to care for their bodies and their minds. And even if they choose not to sometimes, at least they know how. Right. And, and we haven't just silenced the messages of their bodies.
Mm-hmm. That's a really, really good point. Yeah, because it's so common, I can't tell you how many young ladies that are, I've met that are on the pill, and I usually will ask, are you sexually active? And a lot of them, they're like, no, I have period pain and my mom took me to the doctor and they just put me on the pill. Yeah. And it's like, well, did you do anything else? Was there any other things that they checked out? And they're like, no, they just put me on the pill.
Oh my gosh. Another book you should read and share with your team and parents is Beyond the Pill by Jolene Brighton. And there's another, Laura Briden wrote a book called like The Period Repair Manual. Mm-hmm. 2 really good books for just kind of, talking about that. Like, hey, the hormonal birth control pill has a lot of important uses and it's a useful medication, but it's a medication. It's not M&Ms.
Yeah.
So we have to be mindful of all of the ways it affects. There was another brand new book out too on the mental health effects of hormonal birth control. I can't remember the name of it, but, I think we just can't be giving it out like Skittles. We have to really pay attention to what we're silencing in such a vulnerable population that just needs to learn how to take care of their bodies because they're about to become adults.
Yeah. Yeah. So true. So true. And now when women do end up having an excision surgery, how successful is that? What are the outcomes? And I know the research is ongoing, but what are the outcomes? And granted, this is in the event that they actually have the excision performed by a skilled surgeon, because there's so many surgeons out there that tout that they're laparoscopic specialists and their work might say otherwise. So in the event that they've had surgery by a skilled excision surgeon, what are the potential outcomes for that?
Yeah, I mean, the outcomes are pretty good, but I think we still have to put it in context, right? You know, as physical therapists, you know, I've seen post-op shoulder surgery and knee surgery and C-sections, and, you know, the surgeon always thinks it was great. And, you know, and it is great to the extent that they, you know, sewed back together the shoulder, or sewed up, you know, took the baby out and sewed up the abdomen, or, you know, took out the endometriosis lesions, cleaned things up, cleaned up the adhesions. Like, all of that is super valuable, and if done well, can be life-changing. But even the surgeons themselves will admit that sometimes endometriosis, they see it later in other areas that they didn't find it the first time, or it can even grow back in the same area. Now, you know, I've been doing this for 20 years now, and I would say that the surgeries that I'm seeing now, because almost all of my patients see good skilled excision surgeons, because I know who these people are and I send them in the right direction. And a lot of times they come to me from them. So, you know, in those cases, I don't see people needing repeat surgeries very often. And at the most, they might need one repeat surgery. And sometimes there's more complexity, like they also have 𝘊𝘅𝘍𝑒𝑠, or they also have a bowel issue. So they kind of need different surgery the second time. So that can happen. But, you know, when I first started doing this, probably the first 10 years of my career, it was not at all uncommon to be like, oh, this is my 14th surgery. This is my 10th surgery. You know, with good skilled excision surgery, we're talking 1 to 2 surgeries in a lifetime. But I do think that we haven't yet kind of come to saturation of doing pre-op and post-op nutrition and physical therapy, because, you know, you wouldn't send like a baseball player to shoulder surgery and do nothing before and after.
Right.
But we do that sometimes with excision surgery. The best surgeons are pretty aware of all this stuff, because I've been telling them about it for a long time. And a lot of PTs are in their same meetings, you know, but still, it's just not their priority, right? They're in there to do a particular job, which is take out the lesions, clean up the adhesions, fix the fascia the best they can. And they generally do a great job of that. But if you go in prepared with like a calmer nervous system, less inflammation, eating really well, relaxed pelvic floor, you know how to do your pelvic floor myofascial release, you have, you know, good abdominal visceral therapy, like you're kind of go in with as good as you can get, then you have the surgery. And then there's a period of post-op recovery where, again, you're on a really clean diet, you're sleeping well, you're slowly getting back to movement, you're doing physical therapy, you have a lot of support. That recovery is just so much easier because you're not dealing with as much post-surgical inflammation and post-surgical pain. Even still, like usually people can tell within 5 to 6 weeks that the surgery was pretty successful, that, you know, their endo pain is a lot better. They may find that they have some surgical pain, but things are much better 5 to 6 weeks out on average. But the full, complete root cause healing, in my experience, takes 6 to 24 months post-surgery. So we have to keep going to physical therapy, keep doing the nutrition work, and the nutrition and sleep and lifestyle medicine stuff is really as much as you can ongoing. As you build resilience, you know, you certainly can occasionally have a glass of wine, or, you know, eat birthday cake from time to time or whatever, but it's more of a lifestyle shift. You know, you're not going to be, and honestly, no one should, but people do. Like, you're not going to be like eating pizza every weekend and dancing on bars till 2 a.m. Like, it's not what your body is going to be optimally healthy if you're doing that. So and it's a bit of a negotiation because a lot of times, people who are having these surgeries are in their teens, 20s, and 30s, and it can be hard to not go for drinks with your, to network with your new work friends, or, dating can be a real challenge. So I think it's important that we're sensitive to that, and that people kind of learn how to really take care of their bodies and what they're willing to push and not push.
Mm-hmm, mm-hmm. That's a really, really good point. And I think I've got a couple more questions. One is with regards to fertility. A lot of the time, like you say, a lot of women may not be symptomatic. And I think this is one of the things that tends to get a lot of women really frustrated and causes a lot of anxiety, especially for those who may say, well, I've tried to eat well, I've tried to live healthy, I've tried to do these things, and now that I want to have a child, I feel like my body is failing me. Mm-hmm. And I'm thinking back to a former client who, and they were vegan. So they were very particular about what they ate. They were extremely meticulous. And ultimately, I'd made the recommendation to go to a fertility specialist as well as potentially seeing a gynecologist that was skilled with endo. The problem is, she's like, but I don't have any pain. I don't hurt. I don't have any pain. Don't people with endo have pain? And I said, well, they usually do, but humor me a little bit, And so what do we say to those women? Because they're not symptomatic. They're not having the pains and they're not having the issues, especially, again, for those who might have lived a relatively, for all intents and purposes, healthier life, but now they're having issues with conceiving.
Well, I would just frame it as it's a potential part of the differential diagnosis. Mm-hmm. You could be infertile or struggling with infertility for any number of reasons. I mean, honestly, a vegan diet can increase the risk of infertility, because if the fiber levels are actually too high, even healthy women can have anovulatory cycles. Mm-hmm. Vegan diets can be really healthy, but they're challenging to be really healthy. Mm-hmm. It's not something I recommend against necessarily, but it's most of the time not the most optimal. If she was super meticulous about it, it could be even an eating disorder, Mm-hmm. And we can have eating disorders on all spectrums of health, people on fasting and keto, and, all of it can lead to eating disorders if we're not careful. But yeah, so what I would say is it's one possibility, because endo is a very common cause of infertility. Mm-hmm. So is PCOS, there are other things. Those are the two most common. So I would say, I would just have a conversation with someone who's an expert at this, because there are other symptoms. Usually there will also be a little bit of digestive issue, or you may or may not have brain fog, fatigue, things like that, but it can be silent and can be just related to infertility. That's more rare, but it is possible and worth exploring. The other thing, though, that I've found really interesting is that, we're always kind of looking for what's wrong with the woman. Mm-hmm. Male factor infertility is 1/3 of the cause, but I've seen so many patients in my career, especially if they have endo or something like that. In fact, one earlier this week who had a child with her previous partner. It was a while ago. And she has endometriosis. Her endo probably has progressed since then, because her child was like somewhere around 7 years old. But she's now struggling with infertility with her second husband. But no one's ever even tested his sperm. And I'm like, y'all, she had a baby. Like, let's just test it. Mm-hmm. It's really fascinating, because if you look at the infertility stats, 1/3 of the time, no one can really figure out what's going on. 1/3 of the time it's because of an identifiable issue with the woman's health. And 1/3 of the time it's an identifiable issue with the men's health, but they never test the men. So not never, but not nearly as much. So I'm always like making sure that my clients are checking on that as well. Because there are some things we can do with that around antioxidants and things like
Yeah.
that as well. So, but when it comes to that silent form of endo, if you're struggling with infertility, just consider it as a potential thing that might be contributing.
Yeah. And what about the aging woman? So, those that might have had the history of endo, those that might have had or even might not have had the excision surgery, those who may have gone through, like you said, a lot of them may very well have improvements with the onset of menopause, but what can they typically expect as they age with a disease process like endo?
Well, if they're symptomatic related to their menstrual cycle, then a lot of times the symptoms do improve with menopause. Again, it's not a cure for endo, and there are people who need even excision surgery in menopause so that they can relieve the pain. It usually doesn't start in menopause though. So you'll know like you'll have had symptoms for years before that. But so still, especially optimizing digestive and immune health and nervous system health is key all the way for the rest of your life, because those digestive symptoms may not abate just because you're in menopause, but at least the period pain usually resolves. You can still have deep pelvic pain. Then we have to kind of start dealing with issues of sexual pain, vulvar atrophy, and that can be complicated if you also have like deep pelvic pain with sex. So lots of lubricants, local estrogens. There's a thing called the 𝘀𝘦, which helps with deep pelvic pain. Yeah. It's a really cool tool, I guess, to, decrease deep pelvic pain risk. But if someone, has deep pelvic pain with intercourse, and now they also have vulvar pain or vulvar atrophy, using the 𝘀𝘦 is great, but you want to probably also use lubricants and moisturizers and possibly estrogen replacement therapy, or at least local estrogen. There's another product called 𝘩𝘢𝘏 too, that's a little less intensive than actual estrogen.
Now, since the endo can kind of mimic some of the hormonally charged cancers, vulva does have DHEA. Would that be something that you would recommend, or would we make other recommendations there?
Well, if someone doesn't have cancer, I'm not concerned about it really. Although, I would be a little bit mindful if someone has a cancer risk, like if there's a lot of cancer risk in their family, if someone has active breast cancer, it's definitely something they would want to talk to their oncologist about, or even if they've recently had, or they've had cancer before using it. It's quite local, like local vulvar estrogen. It's probably less intense than that. So that's a bit of an individual by individual conversation, but definitely worth considering if someone's at high risk for cancer or has cancer.
Gotcha. Well, thank you so much. I know this is going to be super informative for a lot of people. I mean, there's so many women out there that are dealing with endometriosis. There's so many people who remain undiagnosed, and really don't understand what is happening to their body, why they're having pain. And like a lot of women, say, I've been told, they say, I feel like my body's just failing me. So I feel like when we have the ability to have these types of conversations and get this information out so that people can know a little bit more, it goes a long, long way. So thank you so, so much. So you mentioned your book on endometriosis. Share that with everybody so they know where to get it.
Sure. The book is called Outsmart Endometriosis, and you can download a free copy at outsmartendo.com. It's also available on Amazon, and it will be in print in a couple months, but for now you can get it at outsmartendo.com.
Awesome. And if people want to get in touch with you, questions, concerns, they're up in that Connecticut area. So if you're in Connecticut, guys, go see her. They're up in that Connecticut area. They want you, or wherever they are at. How can they do that?
Yeah. So I do have a tiny clinical practice, but I do a ton of teaching and writing and speaking now. So we have a clinic that's virtual. We work with patients all over the world. We have practitioners in the US and Australia, and we work in Europe and Canada. anywhere. And so you can find that clinic at endodirectory.com.
Awesome. All right, guys. So there you have it. Well, thank you so much, Jessica, for joining me and getting more information out there to the population on endometriosis. Guys, if you have any questions, please check out the Endo Directory, endodirectory.com, and also please go ahead and get that book, Outsmart Endo. I've read it. It's an amazing book. There's a lot of great information in there. So if you've got questions, it's a really great place to start. Thank you so much.
Thank you so much for having me.
All right.